Good morning, folks. This is John Adamson, the Rehab and Documentation Guru. And today I thought I'd talk about your friend, the Center for Medicare Advocacy. So let me tell you why, as a clinician, this organization is your friend. So back in 2011, Glenda Jimmo, who you might know her name through if you've had any education on maintenance therapy, decided to sue Medicare because she was not getting therapy services to prevent or slow her decline in function as a result of her diabetes with associated complications. One of the entities that helped her in her lawsuit against the federal government was the Center for Medicare Advocacy. And what they very clearly pointed out to Medicare and to the federal government as a whole, it was a federal lawsuit against Health and Human Services, is the fact that patients have a right to services even when they don't improve. In other words, under Medicare, there is no provision that states that you must improve in order to have medically necessary care. And this went to the Vermont Appeals Court, which is a federal court under the Supreme Court, and she won in 2013. And so this has helped establish maintenance therapy. Now, why do I say they're your friend? So we've moved largely to an outcomes-based payment model. And the triple aim of healthcare is what that's based upon. And that triple aim is to improve patient outcomes, to reduce costs, and to improve the patient experience. So that's the triple aim of healthcare: improve patient outcomes. So what this new model has proposed to do, and what you get judged on, is whether you actually achieve positive patient outcomes, and that in part establishes whether or not your care was medically necessary. And this flies in the face of the judgment of in the Glenda Jimmo decision, where it was determined that sometimes you need care and you don't improve. And it might be still medically necessary without a positive outcome. In other words, your outcome measures stay the same or even might slowly decline over time. That might still be medically necessary care going on. So what does the Center for Medicare Advocacy do? Well, they are, from what I've gathered from reviewing them and their material, is they're primarily geared towards the beneficiary, the recipient of the Medicare itself, not so much the providers. But I would encourage you to check them out because you will find a lot of material on there. So their website is medicareadvocacy.org. That's medicareadvocacy.org. And here's their mission statement. The Center for Medicare Advocacy's mission is to advance access to comprehensive Medicare coverage and quality health care for older people and people with disabilities by providing exceptional legal analysis, education, and advocacy. And they were established in 1986, and they are a national nonprofit organization, and they've represented a lot of people. One of the things that they also provide on their website are some teaching tools for maintenance therapy. Out of the Glenda Jimmo decision, they had developed a lot of tools to help beneficiaries get access to maintenance therapy. There's three packets. One's set up for outpatient, one is for acute SNF care, and then one is for home health. So those three settings are the ones that were targeted for maintenance therapy, and they have packets that are geared again towards the beneficiary but could be helpful to you regarding maintenance therapy, and the fact that Medicare does not pay for a claim just because patients get better. Patients can stay the same for a long period of time and still need medically necessary care. So anyway, check them out. Get on their listserv. They'll send you regular emails and updates about legislation that's going on and their perception of it. I don't necessarily agree with everything they have to say, but I really appreciate the work that they do, and I think you would too as a healthcare provider in physical, occupational, or speech therapy. Anyway, John Adamson, the Rehab and Documentation Guru, hoping you have a pleasant day. Take care and God bless.